Good morning, Illini. Welcome back. It's another Healthy Illini podcast. I'm your host, Matt Schrock. And it's August. The fall semester is right around the corner, and we're excited about that. Campus is starting to get a little bit of a buzz again. It's always nice to have a break in the summer, but we really do miss the students when they're not here, and that energy is coming back. We're starting to feel that. And with the start of a new semester, we want to introduce someone who's new to the campus in this role. And so we're excited for this one today as we talk with the new director at McKinley Health Center. I'm joined today by two guests, and first off is Awais Vaid. He's the new McKinley Health Center director, started in July 1st. Just a little bit of background. He'll talk more about this as we get into it. But he did have 18 years with CU PhD, that's the Champaign-Urbana Public Health Department. And most recently there was the deputy administrator and lead epidemiologist there. So Awais, thanks for being here.
Thank you for having me, Matt.
I'm also joined by a student today. Haihley Connors is with us. She's going to be a senior this fall, majoring in interdisciplinary health sciences with a concentration in health diversity. But she has been very active on campus over the years, including being active with the McKinley Health Center Student Advisory Board. So I'm really excited to have you here too, Haihley. Thanks for being here.
Thanks so much for having me.
So I appreciate you both being here, but let's start with Awais. You are the new director here at McKinley. And this episode is basically designed around introducing you to campus and especially the student body. So we're just going to start off pretty basic. Can you give us a little background on your journey to this point and what drew you to McKinley?
Sure. Again, thank you, Matt, for having me. It's a pleasure to be on campus. And like you said, this is my sixth week, I believe, at McKinley. So I'm still learning. The good thing is that I have stayed in this community, or I have grown up in this community for the last 18 years. So I was very familiar with McKinley and the campus community as well. But just to give you my background, I was born and brought up in Mumbai, India. Did all of my schooling in Mumbai as well. At one point, I did go to medical school in Mumbai, finished med school, and then decided to take a break, explore what was outside of Mumbai and what was outside of India as well. And so I decided to come to the US for my grad schooling. The initial plans were to finish grad school and then maybe work a couple years to see how the healthcare system works here, and then go back to India and maybe replicate some of what I have learned here back in a country which was very naive to public health, community health, population health. And that's what I focused my education in the US as well. So I went to Northern Illinois, DeKalb, where I got my master's in public health, and my focus was healthcare administration and epidemiology. And as soon as I finished my grad school, my first job right out of that was at the Champaign-Urbana Public Health District, which I started in 2004. And again, the plans were to stay there for a few months, maybe a year, a couple years, and then either go back to India or move to a bigger city. None of those plans materialized because I stayed there for 18 years, and like I said, just July 1st made my first transition in my job to McKinley Health Center.
I laugh a little because you said to a bigger city. We've had conversations. I come from a very small town. My hometown's about 2,000 people. And so when I first came to school here, Champaign seemed like pretty big. U of I was pretty big. And then you were talking about your side of it, where Champaign's basically a very small town
right,
compared to Mumbai.
That's correct. Mumbai has 20 million people. And just my neighborhood, my block, had more people than all of Champaign County. So when I first came for my first interview in 2004, I did not even know where I was going because, it's a small city in my mind. But 18 years, and it's a place where I have grown up, my family has grown, and my daughter, who is almost 18, and an incoming senior at Uni High, was born and brought up in Champaign as well.
Well, we're glad to have you here. I work, for those listening, I work directly for Awais. I'm the administrative aide to that office. And so it has been 6 weeks. In some ways, it seems a long 6 weeks. In some ways, we blinked and it was 6 weeks. It's been a bit of a whirlwind. But with your background with CU PhD, how do you feel like that time helped prepare you for McKinley specifically and a college campus?
Right. So 18 years for me, again, it passed in the blink of an eye. You learn so much about your job, about your community. And I think that's what I did in a lot of those years, is working with community partners in building relationships, because I believe in public health, in population health, community health. A lot of people are working in silos, and when I joined public health, one of my goals was to break those silos, so that we can work better for the community we serve. And not just that, but when time comes for real emergencies or for real action, if you have made those relationships, it becomes a lot easier to tap into them, and they respect you, and you've already made those connections, so it's not hard. That's what I did for a long time, and my connection with the university and McKinley goes a long way back as well. I was working with the director who was even before the previous one, Dr. Palinkis. We worked together for years and years. He could call me on my cell phone anytime there was a concern, and I could do the same. With Dr. Parker, who was the director just before me, I worked with him on an ongoing basis for the last 5 years. And during the COVID pandemic, on average, we spoke multiple times a week. And he could pick up the phone and call me anytime. So that was McKinley. But even the university campus and administration, I have worked with researchers, I've worked with collaborators, I've worked with university administration for so long that I never felt that I was not a part of the campus community or the health system here. It was a very easy transition for me from public health into McKinley. And one thing I'll mention also is that I never felt that the university campus was different. We always thought that the campus community was part of the larger Champaign-Urbana community, and in our planning, in our efforts, the campus community was always part of the bigger Champaign-Urbana community. So we were always planning and working with the campus at all times. So it was no different for me in my previous job than what it is right now.
Well, was that one of the reasons was that one of the draws to coming to a college campus? I mean, you could go work in a hospital, you could work for another state agency if you wanted to make a transition. Was there something about that college interaction that really drew you here?
Right. So yes, I could have gone and worked in a hospital. I could have gone to work for a for-profit corporation as well. But again, my mission has always been, or my passion has always been, community health and population health and public health. And I see the campus as just an extension of what I was doing for the last 18 years. So it was not ever different for me. McKinley Health Center, yes, we do a lot of primary care. Yes, we do some specialty care as well. But what we also do a lot is preventive care. Health education, whether it is dietetics, nutrition, or mental health counseling, or sports medicine. A lot of that is preventive, which has, in my mind, a much larger impact for a lot of people. And so for me, it was never an option of going into a for-profit corporation or to go to a hospital. I was always interested whether I was going to stay at public health for the rest of my career, or if an opportunity comes up, it would have been something which was a setting like a campus, which was an extension of public health.
This is where I want to pause for a moment and bring Haihley into the conversation. Haihley, you've been really active on campus for a lot of years. I've seen you in various committees, various events, including at McKinley. And I know you're very invested in what happens at McKinley. So I'm just going to step aside for a moment and let you take the lead. So Haihley, the floor is yours.
So thanks again for having me here. So I have a couple questions for you. So coming to McKinley from public health, you are familiar with McKinley in a lot of ways. So what is your vision for the next steps going forward, especially after or during the pandemic as well?
Right. So one thing I want to start by saying is that McKinley is an anchor institution which has been around for 100 years, and even from an outside perspective, when I was not on campus, I saw the good work done by McKinley, the staff, for the benefit of the community, the campus community, students, as well as faculty and staff as well. So we are already doing some wonderful work. Now, how you take it forward, especially post-pandemic, is a challenge for all campuses, for all communities, for all healthcare providers. And I see that, pandemic has definitely brought to the forefront a lot more issues. Behavior, mental health, one of them. Employee satisfaction and how employees feel comfortable in the workplace that they are in, or to be more flexible with our approach, including telehealth and telemedicine as well. So all of those things will have to be considered when we are thinking about the next 5 or 10 years, or where healthcare is going in the future. So one of those things will be, for me, again, like I said, looking broadly into how we can be more flexible in our approach, how we can make sure that employee health is given priority as well. Good employees will always be good providers. I think that I do firmly believe in that philosophy as well. And then learning from the students into what are their biggest concerns and how can we address them in the best way possible.
Yeah, so I definitely know that there have been a lot of concerns with patient provider interactions here at McKinley, as far as students not feeling like they were fulfilled in their visit or even listened to. So I'm so glad that that's a part of your plan. So moving forward, you also have worked for the CU PhD for a while and have a lot of extensive background in public health. So what do you think are some things that you've learned that'll help you lead McKinley, and especially in the logistics area?
Right. So one thing I told you or I mentioned earlier is being accessible, first of all, for the staff and for any student, for that matter of fact. If there are concerns, to be accessible, not just myself, our senior leadership team and all our staff, being accessible to students at any time when it is needed. I think that is critical, but also to establish or to even strengthen the connections that we have with other units on campus. There's a counseling center, there is University of Illinois Police, there are social work programs out there. So there are a lot of other programs in this community that cater to wellness and health. The rec center is one of them as well. So bringing strengthening those contacts so that we can provide much more comprehensive health and well-being for our student campus, for our student population, as well as being those respected healthcare authority for the campus administration and faculty and staff. I want campus administration, the faculty and staff to look up to McKinley if there is a health concern, if they have questions, if they have doubts about what's happening in our community, what's happening outside our community as well.
That is one of the challenges, and it's a challenge. It's always been a challenge for any institution of higher learning, is that you're trying to find ways to relate, you're trying to find ways to connect, and you're trying to find ways to be accessible to the student body. A student body that's constantly changing. Right. You're always getting new students in as freshmen who come in, and sometimes they come up with the idea that the older students don't really know what's happening. We're the new, we know what's going on. And then you have the older students who are a little bit more seasoned, but they're still not quite experienced in a lot of their jobs and things like that. So it is tough to to navigate that constant evolution of thought and method and relationships. And so we're talking about you as a director and what you bring to McKinley. You talked about that a little bit, but in what ways do you feel you are relatable to the student body? When they look at you and they say, okay, Awais is the director of McKinley, I connect with him in this way, or I feel like he connects with me in this way. Is there anything you bring to the table in that area?
I always think that I want to make myself accessible. If there is a question, if there is, if somebody wants to send me an email, I will definitely try and respond to those. If someone wants to talk to me in person or over the phone call, I will make it a point to address those concerns. I may not have all the answers myself, but I have a great team out here, and I have a lot of connections in the community as well. So I know the resources, not just on campus, but off campus as well. So we'll try to make sure that that we have the answers that we are looking for. The other thing is, like I said, I've grown up in this community. My daughter has grown up in this community, and she is a incoming senior at the University High School out here. So she's been on and around campus for a long time, and I've seen her grow in the campus community, taking classes on campus, and being around campus for a long time. I have worked with hundreds of, if not thousands, of interns over the last 18 years at Public Health, and 95% of them were from the U of I campus. So I have worked with a lot of students as mentor, as colleagues. I have worked with a lot of researchers on campus as well. So, I've built that relationship, and I have, always tried to keep that trust, whether it's for students or whether it is for faculty and staff. And like I said, I'm not the expert in everything, but if they come to me for any questions, I'll definitely try to find that answer.
Well, and it helps that you've seen the trends in community health on the campus for years. This is not an unfamiliar area to you, and it's not an unfamiliar dynamics to see how things shift and how they've evolved. And that's a credit to what you're going to bring. In my opinion, that's a credit to what you're going to bring to the position, because there is that experience, and that you have seen the short-term trends and the long-term trends both, and kind of know how both of those function in the community and on the campus.
So along with that, students want to know they're being advocated for and their voices are being heard. So outside of that, we have the board for that, for the McKinley Student Advisory Board. But, aside from that, how do you envision being proactive in that area?
So one thing, again, McKinley Health Center exists for the students. It is for the students. It is paid for by the students as well. And I think the staff at McKinley know that. And from my limited interactions over the last few weeks with staff, I see that most of them are here for that main reason is for the service for the students. And I see their passion in doing that. I think I bring the same thing to the table as well. I will always be an advocate for student health. And I know, for a lot of students, especially incoming freshmen, the first year can be, very daunting, trying to navigate a different healthcare system. If you're international, you come with a lot of different perspectives. Some countries have universal healthcare, so the expectation is different, and some countries have no healthcare, so the expectation is completely different. If you're from out of state, if you have always been under your parents' care and they've taken all your healthcare decisions, it could be challenging to make those decisions yourself as well. So one thing that I really want to focus on is health literacy. And health literacy, I think, in my mind, is very important for incoming freshmen as well as people who are or students who are already on campus. Because the more you are literate about healthcare, how you can access services, what terminologies mean, what your student health service provides you, what your insurance provides you, and how it is more important to be able to access primary and preventive care rather than have to go to an emergency room, for a headache or for a toothache or for small problems. How that will be, time savings for you as well as beneficial for the community as well. So I think for me, health literacy is going to be a big push in at least the first year that I'm here.
As an addition to that, for students who do come to the health center, you may get the student satisfaction survey, patient satisfaction survey that is randomly generated. If you get that, please respond, because I echo what Awais said, that McKinley, we want to serve and we want to know what your thoughts are, how we're doing, things like that. And our survey results are really good. The numbers that we have are really good. Our satisfaction is really high, but more data is always good. And so don't just, I do that. I go through like Taco Bell. Taco Bell's my thing. I go through and I get a survey at the end, and sometimes I'm like, oh yeah, I'll do that. Sometimes I just throw it away. If you get a survey from McKinley, please fill it out for us. If you have comments, questions, interact with us. That's partly why we did the podcast, is so that we get feedback. When we have events happening on campus, especially at the beginning of the semester, a lot of them, come talk to us, find out what we do, and that helps with some of that literacy to let them know what we do, how we do it, and we can answer those questions because we want to. Because like you said, Awais, we're here because we want to serve students.
And I just add to that, when you're giving comments, I know a lot of people, habitually only give comments when they have negative comments about some place, but a positive comment goes a long way for our providers who are also working very hard in being here all the time for the students. So any comment is good, whether it is negative or positive. We are always welcoming each one of them.
As we're talking about interactions, I want to flip it around just a little bit. Awais, as director, you have a student here, a very active student, a very engaged student who likes to use her voice to the betterment of the entire community. Do you have any questions you would want to send her way that she could answer here?
Absolutely. So Haihley, one question that I have for you, as a director, I'm always assuming what is best for students and what students want. But instead of me assuming things, it would be best if I learn from you what are the expectations from the new health director, or what would you want me to be focusing on or engaging the student population with, so that I can learn better and serve better.
Yeah, so I would think, of course, being the director, interacting with the student body is incredibly important. And from there, I would say, being personable, being relatable, being able to, speak to students, comfortable with conversing as well. And, along with that, also just being approachable. I know sometimes having, high leadership positions within the university and having interactions with students can be pretty intimidating for the students. But, having that approachableness and, personalness can take you a long way with the students. And specifically, I think we love to see, you come out to our student events, in the earlier in the school year, there are a lot of events on the quad and things like that. I think, showing your face, showing, that you care about the students, even coming to, certain RSOs events, university-sponsored events as well would go a long way for sure. I think the most important thing is just showing students that you are there, you're ready to listen, and you want to listen. I think that would go a really long way.
Thank you.
We do want to hear the student's voice. That's why we have the student advisory board, like Haihley mentioned, she's on. And so if you have more comments and questions on that, you can always contact us at Healthy Illini. We'll be happy to put you in contact with someone if you need to talk to someone specific, or we're happy to engage with you on those items as well. We are a little bit out of time, so I unfortunately need to cut it a little bit short. We could have this conversation for a long time, and hopefully this starts the conversation, and then so someone will come in and want to talk to our staff, or even come and talk to Awais in the director's office. But thank you both for being here. I really appreciate you taking the time.
Thank you so much.
Thank you for having us, Matt.
Everywhere healthcare is continuing to move post-pandemic, and McKinley is no different as we're trying to navigate the new landscape of healthcare, the new landscape of basically the whole world as everyone comes out of this time period. And McKinley has a new director to do so. But I'm excited about where it's going. I'm excited about the things that are in front of us, and I'm excited about the leadership that we have from Awais. As always, if you have questions, if you have comments, if you have concerns, or you have any interaction you want, any conversation you want to start, let us know. We'll be happy to do so at McKinley. We want your voice to be heard. We want you to feel comfortable coming to us and sharing where you're at on your journey, because you are on your own journey, and everyone's journey is slightly different. And so we want to be a part of that as we go forward. But thank you for joining us today. Like I said, you're on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.